Hey guys, Dr. Jake here again with Inver Chiropractic, and what we're going to be talking about today is cervical genic headaches, or headaches that start in the neck, and we'll get to more of that in a little bit here. But what the purpose of this video is I want to be able to show you guys kind of some of the things that we can be doing in our office to help those of you out there in the Facebook universe that are struggling with headaches. Now, when we talk about cervical genic headaches, what I mean by that is if you break down the word cervical genic, cervical meaning of the neck, right? Genic meaning origin or starting point, meaning that even though we have a headache or something going on up here, we perceive that our head is hurting, the problem is actually starting someplace else. So it's a secondary headache. The problem is going on in our neck. The two most common reasons as to why we are experiencing these types of headaches are first and foremost, we have a misalignment or subluxation in our neck. One of the 7 bones in our cervical spine is not moving properly and is stuck and isn't allowing our body to function the way that it should be. The other thing that we see is you see a lot of muscle tension or muscle tightness, probably due in part to those misalignments, but also due to the part of what our posture is doing, what the stresses of our life is doing, the day-to-day situations. All of that can play a part into tight muscles. So what I want to show you all today is what this looks like if we take a look at an x-ray. Now, this is a patient that was in our office. This is a 23-year-old recent college graduate. She came in telling me that her neck hurts her all day, every day, and that she also has headaches like 2 or 3 times a week. Some other things she told me about is that she has a 40-minute commute both ways, or 40-minute commute one way on Metro Transit, in which she spends that entire time looking straight down on her phone because she's watching Netflix. Well, this is what that does to our neck. If we look at our cervical spine, we have 7 bones in our neck, and what we want to see is that this should not look straight like it does right here. It should have a backward C, and the reason why we have these curves in our spine is because that allows for flexibility and movement. As that curve starts to straighten out like what we're seeing here, think about me stretching a rubber band. The tighter the rubber band gets, the more it wants to come back. If we look at muscles that go from the base of the neck all the way up to the skull, if our neck straightens out, that tends to get wider. What happens then is that our muscles want to recoil, similar to what the rubber band does, but they can't because of the way our body is functioning. And also with that, if our neck is not moving properly, if our joints aren't able to move the way that they should be, our muscles are then working overtime trying to pull harder than what they have to get our neck to do what we tell it to from our brain, right? So if we're looking up, down, side to side, etc., our neck should be able to, the bones of our neck, the vertebral body should be able to glide back and forth. If they can't, that stress gets transferred into our muscles. Either way, what's going to happen is that as these signals travel up our spine and get to where the base of our skull is, our brain has a difficult time discerning, is that problem coming from my head or is that problem coming from the base of my neck? And so what happens is that we think that we have a headache when in reality this situation that we're explaining right here is the problem. So what we need to do is that through the chiropractic adjustment, getting our spine moving again, allowing our joints to function at 100% of their capacity, that oftentimes in of itself is a great way to alleviate some of these cervical genic type headache symptoms. So if you guys have any questions with that, please comment on the video below and we will get back to you. If you want to speak to one of our doctors about this, about your headaches, about the stiff neck, give our office a call. We look forward to seeing all of you here. We want to be able to answer these questions and we want to be able to serve you. Thank you so much for watching this video. I hope that you guys have a great day.